This video will illustrate a protocol for performing an injection of platelet-rich plasma for Achilles tendinopathy. The platelet-rich plasma product utilized in this video is the Biomet GPS-3. Attach an 18-gauge needle to the 60ml syringe and withdraw 6 ml of ACDA, which is the anticoagulant. Next, withdraw 54 ml of blood into the syringe. Transfer the contents of the syringe into the separation tube through the central port. Insert the separation tube into the centrifuge. A counterbalance with 30 ml of sterile saline is placed into the opposite side of the centrifuge. Then set the speed for 3200 RPM for 15 minutes. Whilst the centrifuge is running, demarcate the exact area of tenderness with a permanent marker in order to localize the area to inject the platelet-rich plasma for best effect. Prepare the skin with a cleaning agent and inject 2 to 3 ml of 2% lignocaine just superficial to the tendon using a 23-gauge needle. Local anesthetic will make the procedure easier and less uncomfortable for the patient. Note that it's best to inject the local anesthetic at least 5 minutes before the platelet-rich plasma injection. Therefore, an appropriate time to do this is whilst the centrifuge is running. Once the centrifuge is finished, remove the separation tube and extract the top layer, which is the platelet pore plasma, from the yellow port using a 30 ml syringe. The syringe can be tilted to facilitate extraction. Next, connect a 10 ml syringe to the red port and withdraw 2 ml of platelet-rich plasma. Then shake the separation tube for 30 seconds before extracting the remaining platelet-rich plasma. Once all the platelet-rich plasma has been extracted, attach a 23-gauge needle to the syringe of platelet-rich plasma. Place the needle perpendicular to the skin in the center of the previously demarcated area of tenderness. Advance the needle through the skin, subcutaneous tissue, and into the tendon. Then inject a small volume of platelet-rich plasma. Withdraw the needle just out of the tendon and then back into the tendon in a different position within the demarcated area, injecting a small volume of platelet-rich plasma in each of these areas. Continue this peppering maneuver 15 times throughout the demarcated area. If the PRP finishes before this, it is important to continue, as dry needling has been shown to be effective in tendinopathies. Once finished, place a dressing over the site of injection. We would advise that the limb remains in the same position for approximately 15 minutes to keep the platelet-rich plasma localized to the injection site.